COVID-19 cases, especially those caused by the Delta variant, are increasing across the country and in our community. We're also hearing more about breakthrough cases and medications that are approved for other uses being used to treat COVID, causing some controversy. To help sort out all of the latest developments in this ongoing pandemic is our medical contributor, Dr. Ogachika Alozie. Dr. Alozie is an infectious disease expert, so thanks for being here.
Thank you.
First off, let's talk about the rate of infection of COVID-19. The director of the National Institutes of Health recently published a blog that gave us a better idea of just how widespread COVID-19 was in 2020. And Dr. Francis Collins shared this map from the international science journal Nature, which shows the percentage of people in communities across the United States with the coronavirus as of December 2020. So Dr. Alozie, El Paso looked to be at 60%. What does this mean and what should we take from the data?
Yeah, well, I think first of all, even if that number is off by 5%, 10%, it shows that we paid an immense toll between July and December of 2020. It also shows, because we know that that immunity is durable, that by the time we added vaccinations, we created a halo effect around this city. And so that's why you're not seeing our rates skyrocket. That's why you're not seeing our rates be like Austin or Miami or some other places around the country.
And that kind of goes into what I was about to ask you, which is the data providing some context to our current state during this national surge due to Delta.
Absolutely, and I think it's important for people to understand that while this is still the most dangerous time to be unvaccinated in America and El Paso is very different. And so people that are unvaccinated are still being protected. Our children are being protected by the immense amount of immunity that we have in the community.
And of course, there is still a risk of catching COVID even if you are vaccinated. So let's talk about the probability of breakthrough cases. We probably all know someone who's contracted COVID despite being vaccinated, but the New York Times recently published an article sourcing data that shows the chances to be anywhere from 1 in 5,000 to 1 in 10,000, depending on the rate of spread and also the size of the community. So what does that mean, Dr. Alozie, when we're talking about El Paso?
Well, I think a couple of things. The first thing is that we've always talked about vaccines in the setting of it reduces your chance of hospitalization by 25, or it reduces your chance of death by 25 times. This looks at it a little bit differently. And so every day that you go out, your chance is, let's say, 1 in 10,000. To put it in context for people, it would take 3 months of you having that risk every day for you to get a 1% chance of getting COVID if you're vaccinated. And I think that is the power of the vaccines.
Okay, so again, your message is get vaccinated.
Absolutely.
And Dr. Alozie, I want to hear your take on ivermectin. The FDA warns Americans to not use ivermectin to treat COVID, but there is a misconception that ivermectin is only a deworming medication for large animals, but there is a use in humans.
Yeah, absolutely. So as somebody that went to medical school in Nigeria, I've used ivermectin on both onchocerciasis and strongyloides. Those are big names for worm infections. I think the other thing to think about is that the average dosage in humans is 15 milligrams. I've seen and heard of people that are using up to 6 grams because they're getting it from a veterinary store. And so this is dangerous. This is the only time I've ever seen somebody take ivermectin and have liver damage and have eye damage. And so this is not what we should be using. There are much better treatments than ivermectin.
Okay, and we do know existing medications have been used experimentally on COVID patients with success, like remdesivir, convalescent plasma, and bamlanivimab, but ivermectin is used in other nations. Has there been any success elsewhere with ivermectin that led people to seek this out and self-medicate?
Well, I think that one of the problems is that in COVID, we've been so afraid, we didn't know what we didn't know. And so a lot of the reports online have come from really small, spurious studies. 100 here, 200 there. They're not randomized controlled trials. There are actually 2 randomized controlled trials that are coming out within the next 2 months. That will give us sort of the definitive drive. But we know what works. Dexamethasone works. Remdesivir can work in some. Actemra. But at the end of the day, and I think we say this every time, get vaccinated. That has the most data. It almost sounds ridiculous to say, I don't want to take this thing that has the most data, but I'll take this thing that deworms animals and is used for worm diseases in humans.
Okay, good advice there. Dr. Ogachika Alozie, an infectious disease expert and ABC7's medical contributor. Thank you.
Thank you.